together for health, stand with science. And our speaker is Dr. Arvind, who is a very active member of IMA Gadag branch, and he's also associate professor in Department of Community Medicine. Once again, I welcome. I request President Sir Dr. Virabhadra sir to say a few words before the proceeding.
Thank you, sir. Sir. I am a
Sir,
prayer.
Dr. Manjunath. I am a prayer.
Hello.
I'm
Good evening, sir. Yes, sir. Yes, sir. Wonderful. I am a prayer. May everybody be happy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Flag solution. We, the members of Indian Medical Association, stand here to salute our national flag. Its honor and glory shall be our light and strength, and its force shall be our force. We pledge our allegiance to it and realizing our responsibilities as the accredited members of this national organization, we swear we will dedicate everything in our power to see it fly high in the Committee of Nations. Jai Hind, long live IMA.
Thank you. Now I request President Sir to say a few words before.
Sir, welcome, Adi.
Yeah, I welcome sir. I welcome already. Welcome all once again, all the members, President Sir, Secretary Sir, and all the members of IMA. Request President Virabhadra sir to say a few words.
Also, Dr. Girish, our Karnataka Academy of Community Health State President,
welcome,
he is
sir.
also in the part.
Yes.
Welcome him also.
Good evening, everyone. Happy Women's Day to everyone. It's a good motive from AMA AMS. I congratulate Mulki Patil and Manjunath for arranging this webinar and let it go smoothly. And at this time, I would like to recognize that Dr. Girish is a good friend of mine there in the webinar. And I welcome today's speaker, Dr. Arvind Rinaganavar, for this webinar, and hope this will deliver good lecture on this occasion. Thank you very much.
Thank you, sir. I request Dr. Manjunath to introduce today's speaker, Dr. Arvind. He's a well-known figure. Still, the protocol briefly introduce.
Good evening, all, once again. It's my pleasure and happiness to introduce my good friend, Dr. Arvind. He has done MBBS from Kim's Hubli and M from UMS Ballari. He has worked as a faculty in Kerala, Mysore Medical College, and currently is working in KHP IMS, that is Gadag previously it was Gadag Institute of Medical Sciences, Gadag. And he has 40 plus national and international research publications and presented research papers at state, national, and international conferences, and he has won 7 Best Paper Awards. And many research projects were granted by, he has conducted researches granted by the ICMR, WHO, and state government. And he's been awarded by IME as Dr. Ketan Desai Yuva Leader Award from headquarters, and has trained more than 20,000 students about how to quit tobacco. So, and also is very much active in our cricket circle, and also is very enthusiastic IME foot soldiers, I can say. So, welcome, Dr. Arvind, and hope everyone will gain the knowledge from you. Thank you.
Thank you. Praveen sir, yeah, you can just proceed, sir.
Yes, sir.
Welcome once again.
Thank you.
Please start your presentation.
A very good evening to all of you. At the outset, I thank the IMA, KSB, especially the AMS branch, and I thank Virbhadra Rai sir, President IMA KSB, Dr. Suri Raju sir, the Honorable Secretary IMA KSB, and Dr. Mulki Patil sir, the Chairman IMA KSB AMS Wing, and my close friend Dr. Manjunath Nekar sir, Secretary IMA KSB AMS Wing. And I thank all of you for giving me this opportunity. Just I will share my slide now. Is the slide is visible?
Yes, sir.
Audio, no?
Yes, sir. Full screen, sir.
Yeah. Okay. Very good evening once again to all of you.
Just make it full screen, sir.
I made it full screen only.
For us, it is.
Now?
No, still not shared, sir.
Once.
Arun, just now you have shared you share share the screen.
1 second, sir. 1 second.
It's doing, sir. Yes, sir, it's doing. Okay. Just open the PPT and minimize, sir.
Now it's fine, sir.
And now it's coming, sir. Just a minute. Now your PPT we can see, sir. Only full screen slideshow, sir.
Now?
Wait. Yes, sir.
Yes, yes.
Thank you.
Yes. Okay. Once again, a very good evening to all of you. As we the doctors, we know that every year the World Health Day will be celebrated on 7th of April. Every year they give a theme for this day. The theme for this year is Together for Health, Stand with Science. Together for Health, Stand with Science. As we know, the World Health Day, which was established, the WHO is established in 1948. 1948, 7th of April, it has been established. In this mark of the anniversary celebration, we observe World Health Day. Every year, this WHO focuses on a specific urgent global health theme each year to highlight priority areas of concern so that we can combat and create better awareness in the society. So when you see the history of World Health Day, actually it started in 1800, okay, 1800 years. That time, the lot of the travel were there for the trade and all. That time, because of that, there was the spread of diseases across the globe in different countries. That made have lot of epidemics between 1830 and 1847, and it has taken lot of lives, around 10,000 of lives of European due to cholera and other communicable diseases. This led the formation of International Sanitary Conference in Paris in 1851. After the Second World War, there is the establishment of United Nations in 1945 to have a better global health organization. After that, we have finally WHO is established in April 7th, 1948. But we celebrate World Health Day from 1950, April 7. After 2 years of establishment, the main chairman was that time was Rene Sand was the chairman for in 1948 when it was been established. So as I told in the beginning of the WHO's days, most of the communicable diseases we already eradicated, like smallpox. Still it is a public health problem, the TB, the malaria were highlighted in the early part. Now they are mainly concentrating on primary healthcare, sanitation, and non-communicable diseases and better climate changes, including the clean water availability. Now it is a priority for us. So on this day, what we exactly do is we create the awareness in the public regarding that theme of that year, and we give some inspiring action, so that what all the actions all the public including the doctors community has to take to combat that particular public health problem. And we invite all the complete world to unite for this important cause for the better future. Okay, so these are the different themes since 1950. The first theme was know your health services. Like this, the second theme was health for your child and world's children. Like this, every year, without missing a single year, every year they started giving a theme and created lot of awareness in the public regarding that particular theme. It included communicable diseases, non-communicable diseases, environmental changes like global warming, everything. If you just read the themes, it has covered everything. As we say, community medicine is everything under the sun, including the sun comes to community medicine. So they have included everything which have a impact on the health of an individual. So this is how, like smallpox, as majority know, it already eradicated in 1975. The point of no return, that was the theme. Like this, every year they given a theme. For this year, the previous year theme was healthy beginnings, hopeful futures. Like that time they have given a better health, healthy lifestyle behaviors, better food habits, everything, so that we can have a better future without much non-communicable diseases. The similar way, this year the theme is, as you already know, together for health, stand with science. So this campaign calls all the government officials, scientists, health workers, partners, and public to stand with science by engaging with evidence-based medicine. Evidence is facts, science-based guidance. Ultimately, to protect health, rebuild the trust in science and public health, and support science-led solution. That is one of the major theme for this year. As we know, health is defined as a state of complete physical, mental, social well-being, not merely absence of a disease or infirmity. So as majority of us know, there are 4 pillars in the principles of primary healthcare. As we know, the equitable distribution, community participation, intersectoral coordination, appropriate technology. The recently, few months ago, we have talked the ICMR has pushed the concept of One Health. That is nothing but the intersectoral coordination between the environment, animals, and the humans. That they're focusing currently, so that everything will come under one frame. So the One Health initiative is an important theme for this year. As already told, it includes the zoonotic diseases, antimicrobial resistance disease, and antimicrobial resistance. It is a major concern nowadays, because every year we are seeing that lot of antimicrobial the resistance to antibiotics is increasing day by day. It is becoming challenging for majority of the physicians to treat the infections. Third one is food safety. The fourth one is climate change. The climate and the health, with all these 4 components which are coming under One Health initiative. As we know, the zoonotic diseases are one of the important, so that from the wildlife to the general public, it will cross the borders, and the diseases in the animals will come to the humans. We need to tackle all these things under One Health. So animal reservoirs, it will come through the vectors, human gets infected, and they spread the disease to across the globe. So we have to tackle all the zoonotic diseases also, because they're important threats for human health. As second one, what I told was important was the antimicrobial resistance. As we know, especially the tuberculosis, we are getting MDR TB, XDR TB. When I was a postgraduate, the word was TDR, total drug resistance, but they have removed that word. But currently we have MDR and XDR TBs. Because of that, we are not able to treat the tuberculosis. Since 144 years back, in 1862, they discovered TB bacilli. still we're not able to control much, almost 144 years, because one of the main reason was antimicrobial resistant cases. Not only tuberculosis, lot of the especially my friend was telling, the lot of urinary tract infections, which are majority of them were antibiotic resistant. Then how to treat those patients? So nowadays important is there is a rise concern about antimicrobial resistance. The major reason is important is therapeutic factors, because the dose, the duration, the over-the-counter drugs and over-prescription, and not only that, some of the quacks they prescribe antibiotics for all the viral infections, and people will not take the appropriate doses. As we know, if we prescribe for 5 days or 7 days, they'll stop after 1 or 2 days. If as soon as the symptom subsides, they stop the antibiotic course. These all the reasons are increasing, so we need to create the awareness, and we need to motivate all the patients to ensure that they complete the course antibiotic course without any stoppage in between. So that is so that we can treat the cases in a better way in future. And also the factors of the bacteria, the gene transfer, poor adherence to antibiotics, and environmental changes also have some role in antibiotic resistance. That is the pharma companies, the pollution, and the hospital waste. And the third important is the climate change, as I told, the global warming. We are talking about this since our childhood. Global warming, the greenhouse gases like carbon dioxide, methane, nitrous oxide, and all. These all are increasing the global temperature every year. Every year. As we know, as the temperature increases, there are a lot of diseases which are increasing, especially the communicable diseases increasing in the public. The day area is related to the temperature and precipitation. In majority of the countries, the air is increased by 8% by just increasing 1 degree centigrade temperature. So you can just imagine, in especially underdeveloped countries like African countries, this is one of the major problem for them. Okay, so that we need to act upon to ensure that there should not be much global warming every year. As we know, the major causes are volcanic eruptions, burning coal, oil, petrol, diesel. Because of the war, actually, we're not we're literally using little petrol as much as possible just to save for our future. Industrial pollution, especially the deforestation is in such a rampant way, so that it is increasing lot of global warming. And our vehicles, in each house there are around minimum 2 to 3 vehicles everybody is using for a minimum distance. Also, they don't walk at all, and they use these vehicles which emits the gas, which is very very dangerous for our environment. And the last one is the urbanization. As we know, lot of people, okay, come to urban and they work in factory and everything, it will increase the pollution. So what happens if there's a global warming, if the climate change? Then it increases the heat waves. As we read recently, so many people have died because of high temperature, especially in northern part of India. Because of temperature, around 30-40 people lives we lose. Okay, it increases the disasters like cyclones, the floods, okay, drought, okay, crop damage, water scarcity, and public health issues. Okay, we need to overcome this climate changes. Okay, so heat stroke, it increases, and vector-borne diseases, the malnutrition, everything is related to climate change. Everything related to climate change. So we have to act by at least planting as much as possible. We need to plant so many trees. Very important. We can, every day we have an World Environment Day. Not only that, we can encourage all the students community, not only in MBBS, in the high school, PU colleges, degree colleges, ensure that at least everyone will plant one tree on their some important vacations like their birthdays or their parents' birthdays, so they can be a part in reducing the problem due to climatic change, including the carbon credit. And as we know, the theme is together for health. As we know, here the main person is the patient. Ultimately, he should get the benefit of all these things. Okay, when we think of in all the angles, we have different pathis like Ayurveda, we have homeopathy, we have Unani, Siddha, allopathy, naturopathy. Lot of healthcare systems are there. Okay. The only point is we need to act as what we have studied. The Ayurvedic person has to practice Ayurveda only. The homeopathy has to practice homeopathy only. The allopathy has to practice allopathy only. We should restrict our practice to our what we have studied, so that there should not any mixopathy. That is important. Ultimately, ensure that we should not blame each other system. That is good, that is bad. No, that should not be done. Ultimately, ensure that, because we know some of the chronic diseases were well treated in Ayurveda when compared to allopathy. Ultimately, we should ensure that, okay, because we need to stand together for the better health of the patient, okay, and encourage each and respect each healthcare systems. When you think in allopathy itself, we have different health departments. We have nursing department, paramedical department, dietitians, laboratory technicians, physiotherapists, pharmacists. If we need to respect everybody, okay, without blaming each other, we need to stand together for a better health. Again, in our healthcare system, we have primary healthcare, secondary healthcare, tertiary and quaternary healthcare system. Here, what happens? Some of the doctors that they start blaming their primary health doctors or secondary when the patient gets referred. We should not do that. We should have some better ethics between the doctors, so that the patient, we should not be denied for any good treatment. Okay. Here, some doctors will blame their own colleague or their junior colleague. Those should not happen. So the important here is they should not criticize their own colleague. Very, very important, because a lot of the patients wants to have a second opinion what other doctor says. So that time, when they go to the second doctor, they should not criticize the first doctor. If his diagnosis is wrong, his treatment is wrong, that should not be done. Very, very important. Okay, that professional courtesy we need to have. And important is we need to avoid public criticism. Okay, in front of the patient, we should not scold any doctor. Very, very important. Otherwise, the patients itself, they lose the trust in that respective doctor. So because what I told you, we together for health, we need to stand together for a better health of the public. If really, if they have some conflict of interest, okay, there is a lot of proper channels of grievances, like we have a KMC, or okay, we have a court. They can okay, they can go through that, not to criticize in the public. Very, very important. So each doctors, irrespective of the system of medicine, they should respect each other. Ultimately, ensure that the final beneficiary, that the patient should get the best possible treatment, and all the doctors and other healthcare providers should stand together. Very, very important. So what happens if we blame the doctor? There is erosion of trust by the patient. Okay, increased violences and unethical competition happens. Okay, that is one of the reason. Okay, there simply a lot of the quacks, they prescribe antibiotics left and right and center. Okay, that is increasing AMR. So those unethical competition should come down, and okay, so that we can give a better health to the patient. The second theme for this year was stand with science. Okay, as we know, the evidence-based medicine is very, very important. This campaign calls on government, scientists especially, and the public to trust the fact and evidence-based guidance to strengthen the health system and protect lives. Okay, so scientific foundation is more important. The modern medicine purely relies on the data, not just by some expert opinion. Why we need to stand with science? Because it ensuring evidence-based guidance in a world of pseudoscience. Because a lot of wrong practices, customs we still existing in India, okay, which doesn't have any evidence, okay, that is killing a lot of, especially the pregnant women, and the early neonatal mortality rates are increasing because of pseudo science. We need to combat that. So as we know, there's evidence-based pyramid, from the expert opinion to systematic review and meta-analysis. So every science has some evidence. Only those things we need to practice. Okay, for that, the important thing is we need to have a research as much as possible. So if the researchers, if you think, okay, when we compared India versus the developed countries, we're really so very, sorry to say, we're very, very far away from the developed countries. They are like almost, you can see the GDP, we're just spending 0.6. They are spending around the 4 to 5 times than what the India is spending for the research expenditure. Okay, and we need to increase this, and the government, especially the political commitment, should be there for that, so that they can give better funding for more research activities, so that our scholars, the scientists, can generate some good evidence with the science. Very, very important. So if you see the patents application since last 10 years, India versus USA and China, okay, we are in thousands, America is in lakhs, okay, China is in millions. So see that comparison. When you think of this, we are very, 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 very far away. So I request all the doctors, the future doctors, and my seniors, to please encourage your junior faculty and the students to do as much as research activities, as much as patents they should get, so that they will generate so much of evidence. Okay, and it advantage is such misconceptions, like you have seen the lot of pastors, the church and all, they do some pseudoscience and try to treat the patients. That those set mindset, the people should come out, and they should believe the evidence-based medicine. Evidence-based medicine, very, very important, so that we can remove all such nonsense which is done in the, which you can watch in the YouTube or in the TV. So we see some nonsense things happen and they treat the people. It should come to zero. It should come to zero. And with help of this evidence-based medicine, we can have a lot of good GCP, that is good clinical practices. We can have good protocols. We can generate better protocols by, this is not just trial and error method. If you do like this, if you do like that, how the patient outcome can be improved. Okay, so one of the recently, like 1 year 2 years back, the King Charles was waiting in the corridor for more than 24 hours. Okay, so then the hospital started changing their policy, the admission policies, how they should go through the different levels of healthcare, everything they gave it, because everything should be evidence-based protocols. Okay, the advantage of having better protocols is it reduces the medical errors, improve patient outcomes, enhance operational efficacy, better resource management, because especially India is always case of lot of resources, and medical legal protection also will be there for us, so that we always should have a policy. If a patient comes with snake bite, what all the things step by step we need to do, it should be there in the respective OPDs, wards, or in the casualty. That protocols are must. It only can be generated by a evidence based, that because of the science. So we need to encourage more and more research in that. With this, to summarize, okay, I request everyone, please encourage your friends and juniors and seniors to go for lot of research activities. Let them generate evidence. Let us all stand with science. First point. Second is, we should stand all together. Okay, including the animals, the environment, and the humans. We need to act upon, so that all, and we all should act to have a better environment. Let us pledge to plant as much as plants as possible. Number one, unnecessary, we should not prescribe any antibiotics, and ensure that we have a better treatment for the diseases which are comes in the animal, the zoonotic diseases, so that everybody, that's the intersectoral coordination, will work with veterinary doctors, the engineers who work in the environmental engineers and all, with along with the public health faculty, including with clinical doctors. So because we don't want to go too fast, we want to go too far. So if we want to go too far, we need to go together. All the systems of medicine, all the levels of care, all the allied health sciences, and the public, in creating better public awareness. Okay, we need to stand together. Let us put our hands together for better health for the future generation. Thank you, one and all. I thank once again the IMA KSB, all the office bearers for giving me for this opportunity. Thank you, one and all.
Thank you, Dr. Arvind sir, for your nice talk. And anything anybody want to add or ask? Suraj sir, we missed you in the beginning.
Sir, Dr. Suraj here, very well explained, sir. Thank you very much for your valuable,
Thank you, sir.
inspiring talk.
Thank you, sir.
Today, as we are all celebrating World Health Day, I think it's we have to stress on the prevention of so much of problems are there, sir, like obesity, diabetes, hypertension,
Yes,
which
sir.
are preventable, and we are becoming the capital of entire world
Correct.
in
We're
many
diabetes
conditions.
capital, sir.
Yeah, and as you told, very rightly said, sir, we have to work together. So now vaccination is there to prevent the diseases. Although overall health from 1947, our survival has gone up from 37 years to 70 years.
Yes, sir.
Still, we are living with so many problems, sir, like health-related problem. As you told, again, tuberculosis, multi-drug resistance is the biggest challenge now.
Yes.
Like that, and it is the prevention is the best way, sir. And you told rightly said, sir, we had to protect the environment, sir. And we have to plant the trees. There is the deforestation is happening, and industrialization. We are not protecting our environment, sir. We are very greedy people. We are very greedy. Overall, we are destroying the nature, and because of this, there is ecosystem is imbalance happening, sir.
Yes, sir.
We have to, for our future generation, we have to take very good steps. Then only our future generation will be safe. That's what I feel, sir. Thank you for your valuable talk, sir.
Thank you, sir.
And on the call given by IMA Karnataka State Branch, many branches have, today's, organized walkathon and created awareness about the preventive healthcare checkups, etc., sir. Thank you, sir. Thank you for your talk.
Thank you, sir. Thank you.
Good evening, Arun sir.
Good evening, sir. Good evening, sir. How are you, sir?
Fine, sir. Very informative talk. Really, we are proud of you.
Thank you, sir. Thank you, sir.
Thank you, sir. Congratulations and thank you very much.
Thank you, sir. Thank you.
Yes, sir, Lakkol sir, joining.
ಏನ್ ಸರ್ ಬಹಳ ಚೆನ್ನಾಗಿ ಒಳ್ಳೆ ಕಾರ್ಯಕ್ರಮ ಹಮ್ಮಿಕೊಂಡಿದ್ರಿ ಸ್ವಲ್ಪ ಲೇಟ್ ಆತ್ ನಂದು ಹಂಗೆ ಕೇಳ್ತಾ ಇದ್ದೆ ವೆರಿ ನೈಸ್ ಸರ್
Thank you. Sir, thank you, sir. Thank you.
ಥ್ಯಾಂಕ್ ಯು ಮಂಜಣ್ಣ
Thank you, sir.
ಓಕೆ ಓಕೆ ಓಕೆ
And also from usually whatever we do, the CMEs or health education in the society, it is all towards the science only. All the myths in nutrition or treatment or everything. So we are progressing towards the complete where our decision depends upon the science or the evidence, as Dr. Arvind said. So the World Health Organization theme for this year is very apt at this point of time, so that we focus more on creating awareness about the actual facts and the science behind that. Just like just simple things like initiation of the breast feeding soon after the birth, or giving them more water during the diarrhea, and avoiding the glucose, sugar-rich carbonated drinks. All these things, just it is towards that step. So, and Arvind has explained very well these points. Thank you, Arvind.
Thank you, sir. Thank you.
Anybody? Yeah. Nothing is there.
Dr. Ginesh, sir.
Dr. Arvind, I have one question for you.
Sir, please, sir.
one of the major epidemics these days, like not like COVID, like COVID, mental health problems
Yes,
are in
sir.
rise.
Correct, sir. Correct, sir.
Do you want to highlight about the rising, alarming health related, means mental health related problems, and what is your opinion, doctor? Because
Sir, the major reasons what I think is because of one is the mobile. That is one. Second is the nuclear families. Okay, they don't have a much support, and some of the students, including the medical students, they're having a single parent.
yes,
The third one, and fourth is the expectations, sir. They have a high expectations of living,
yes,
and they're not able to meet them in the early part of the. Everybody wants it very early. So the
yes,
expectations are high, but what they're getting is very less. That is because of that they're going for the lot of depression.
yes,
And I really actually all the schools and colleges we need to train the high school teachers and college lecturers to identify the students who are not actively participating in the day-to-day college academics or extracurricular activities. We should identify them. We need to train them how to identify those all signs and symptoms. We need to train to the teachers. Further, we can have some collaboration with the medical college. So if anybody has, they can directly refer the student to the psychiatry department. Ultimately, they can get the counseling as early as possible in the beginning stage of their health, mental health problem. Only if they get that counseling from the psychiatrist along with the pharmacotherapy, I think we can definitely combat this mental health problems.
yes. Thank you, doctor. Because it has become silent epidemic.
Correct, sir. Correct, sir.
That we are not even, sometimes we fail to recognize.
And there is
And
one more, the stigma is also too much, sir. Stigma is also
yes,
too much.
yeah,
The people will not come so easily to the psychiatrist. That is also is there, sir.
actually, WHO definition, it is not merely the absence of the disease. It is also the mental status as well as your relationship with your family and
Correct, sir.
friends. That's what it
Yes, sir.
says.
Yes, sir.
So, thank you, doctor.
Thank you, sir.
Thank you, sir. Anybody has any questions? Shall we propose vote of?
Yes,
Manju, vote of thanks.
yes, sir.
Yes, sir. Thank you,
Yes.
Dr. Arvind, sir.
First,
Please propose the vote of thanks. Yeah.
first of all, I thank our IMA KSB President, Dr. Virbhadra sir, for allowing us to conduct this program and joining and actively participating in the program. Thank you very much, sir. And also our Honorary Secretary, IMA KSB, Dr. Suraj sir. Thank you very much for participating in our program. And I thank our President, Chairman for IMA AMSK Karnataka State Branch, Dr. F.I. Murthy Patil sir, in supporting and giving idea about conducting this World Health Day talk. And and the center of the attraction today is Dr. Arun for accepting our invitation and giving the informative talk. Thank you, Dr. Arun. And also I thank all the participants in the webinar, especially Dr. Girish, who is the president of Karnataka Academy of Community Health of Karnataka State. Thank you very much, sir, for being in participating in the program. Thank you. Thank you, one and all.
Thank you. Thank you, sir. Thank you.
Thank you. Thank you, sir.
And I have thanked Mr. John, who has supported, who is the brain behind this meeting. Thank you very much, John.
Thank you, sir.
Thank you, sir. Once again,
Thank you.
thank you, one and all.
Thank you all. Thank you.
Good night.
Bye. Good night.